Behavioral health crisis services in our community has evolved greatly over the years. Really, it has expanded to meet the unique needs of our community and has also expanded as we've seen the behavioral health need in the community grow. For years, we've had the requirement in Oregon statute to operate a crisis line and a mobile crisis team that is available 24/7 for all community members.
The mobile crisis teams and the mental health response team always tried to help connect people with ongoing care. So one, we can provide referrals and support accessing care. Also collaborating and coordinating with current providers. You know, we can contact them, let them know we've had contact with their client and kind of whatever safety plan we develop. A mobile crisis response is a best practice. And there's a lot of benefits just in terms of meeting people where they're at, making sure there's no barrier to getting care. And a lot of people are more comfortable staying at home, being in their own environment. They're already stressed and experiencing a crisis. So having people come to them can really alleviate some of that immediate stress and barrier.
As we've learned about our community needs, we've added additional supports as well, namely our mental health response team.
And I'm part of the mental health response team, which is made up of deputies from the Sheriff's Office as well as law enforcement officers from our partner agencies such as Hillsborough, Beaverton, Tigard, Tualatin, and Sherwood. The other part of our team are made up of crisis therapists, and they are master's level clinicians who have experience dealing with crisis. And we ride together in a patrol vehicle for our shift and respond to emergencies involving crisis.
The calls that we're responding to are high acuity calls. So they're individuals who are in immediate crisis or in a place where they're not safe or something unsafe is happening. And for us to be able to walk in there and provide someone that support, we do need somebody else there who's able to monitor safety, to make the scene safe. And so we wouldn't be successful in what we're doing if we didn't have the support of our partners.
And also in 2017, we opened our Hawthorne Walk-In Center, which is a mental health urgent care center that supports both mental health and addictions needs of the community for folks that have that urgent need, but don't necessarily need the mobile response in the community.
Someone can come in one day and feel like they have lost complete hope and just feel completely alone, and be that person that can kind of not only revive that a little bit, but show them that there are people out there who care. There are people out there who are human beings going through the same things as them. It is intimidating and it is hard to go through, but it's not impossible. And with the right people around you, I think it really does make a difference.
Sometimes people will open a door and they'll share they feel like they're all alone and nobody knows what they're going through. And if they're living with something that I can relate to, then I will definitely say, I have experiences XYZ, I've been to the hospital, I've been in the back of a police car going to the hospital when I didn't want to go, and this was my experience. So I definitely am open and candid and will share, similarly with substance use, and will share my history with addiction with people. Kind of will feel it out and see if it seems like it will be helpful to them or if it will be too activating. So it really just depends on the person.
Seeing how responsive and proactive Washington County has been, I think that they have always been very creative with trying to create services, but also listen to the community about what's going to work here in this county.
We're looking really close at our data to see who is and isn't calling our crisis line, who is and isn't coming into Hawthorne, and seeing how we can continue to develop supports that are welcoming, that are culturally responsive, and are able to support every single one of our community members, regardless of the community that they are living in and coming from. The needs of our community are huge, and we know that we can't do it on our own. And so partnerships that we have with the Sheriff's Office and other law enforcement agencies, partners that we have with other system partners, they are critical to meet the community needs. We want to make sure that wherever somebody interacts with the behavioral health system, they're getting a caring response, they're getting a trauma-informed response. And so we take our partnerships very seriously.
So when we respond to calls, we try to lead with compassion, understanding. We try to understand and know that they do have past trauma, and we try to work with that and be sensitive to those needs to try to gain rapport with them and build trust.
I think we're really lucky to operate in the community that we do in Washington County and the system of partnerships that we have.